Okay, let's get started. From the topic of the webinar, as you guys would have already understood, today we'll be going into a live demo of OpenEMR and what it has and what can be customized and how we can customize it for a specific clinic or a specific workflow. So it can be for any specialty or it can be for a specific clinic. For example, if you have a infusion therapy clinic, you have a unique workflow. So how we can customize that. Before we jump into the demo, a bit of a background. As you guys are aware, OpenEMR is a open source EMR platform, which means that the code base of OpenEMR is available for free. Any one of you can create a package, download it, install it, run it locally, or run it on cloud. So that's what OpenEMR is, and I'm 100% sure all of the visitors here are aware of what an EMR is. So without further ado, let's jump into OpenEMR. So while going through the modules, I'll let you know which ones are originally available in the base OpenEMR, which is the free version, and what are customized from Capmines. A bit of a background about Capmines. Capmines is a health IT company, and we are the largest open EMR customization organization out there. So, which means that we have the largest number of custom open EMR solutions deployed in the States. We have deployed our open EMR solutions for private enterprises, mid-sized hospitals, large hospitals, federal government, and many more areas in the US. So OpenEMR, like any other EMR, has the basic functionalities of, the calendar, the patient finder, messaging, patient lists, a very minimal billing manager. So let's go through those modules and then I'll let you know what can be customized and what level of customization can be done in OpenEMR. So let's look at the calendar module here. So calendar module is very simple. It lists out your times availability, and then it allows you to create an appointment directly from the calendar screen itself. And on the left hand side, you can see that we have the provider list. And if you're an administrator and you have multiple locations, you can scroll between those locations, and you can also scroll between different providers of those locations. So here you can see that I have already created some dummy appointments, and once you select all users, it will show you all the different providers within the organization, and it will automatically walk you through that. But if you select a single provider, it will show you their calendar alone, and it can also be sorted between day, week, and month. So let's jump into the appointment scheduling screen. So if you select a time here, and if you select a category of appointment, if you select a title of appointment, and the facility, billing profile, and once you mark the status as arrived, the appointment automatically gets created for that particular time slot. Now here you will see one peculiar thing, which is the telehealth. So this does not come with base OpenEMR, but at Capmines we can customize your OpenEMR system and connect it with any telehealth system that you want to connect with be it Zoom, be it Google Meet, be it Doxy.me, be it Twilio, any telemedicine module you want to think of, we can connect it with. So this is about the calendar screen. And also, if you guys have any questions about the demo, please feel free to add it in the comments. I'll be addressing those after the walkthrough is done. Now moving on to the patient list. This is how the patient list looks like. You can see here I have added some dummy patients already. Then this is a customization we have done. This does not come with base OpenEMR, marking the patients as active or inactive. For example, if you haven't seen a patient for the past 6 months, we can mark it as inactive, and the active patients will be the one which you are seeing regularly or for a particular time period. Now, going on from here, if you select a patient, it will take you to their dashboard, and in the dashboard, as you guys are aware, you'll be able to see their vitals, their billing details, their demographics, their insurances, their messages, all of these details. Another thing you would notice here is we have added an eligibility module here. So at Capminds, we can customize the OpenEMR system to connect it with a clearinghouse, and you can run the eligibility directly from the system itself. So you don't have to use Availity separately, or it can be any other clearinghouse. We can work with them and we can integrate it into the system directly. So on the dashboard, you'll also see authorizations, intake reports, documents, anything related to the patient, you'll see it here. Then you also have clinical reminders, recalls, future appointments, recurring appointments, problems, allergies, medications, immunizations. Also, we have here, so the base OpenEMR does allow you to add your Vena credentials and it integrates with that. But we can also integrate with Sure Scripts, any other e-prescription vendor like New Crop and all of that, so that you can use those e-prescription vendors as well for both Schedule 1 and Schedule 2 drugs. And then, so this is about the patient dashboard. And another thing that you would notice here is these are some of the modules or buttons we have added in the OpenEMR system. So you can create a task for this particular patient. You can see their future appointments, all of those directly from the screen itself. Now, another module you'll see here is your flow board. So flow board is more of a day view. So you can see what kind of appointments you have, what is the appointment status, what is the total time spent, the drug screening, all of those details. This is for you to maintain like a singular view of the system. Then this is a custom module which we have created for one of our clients, which is a doctor's dashboard. So here you can view your productivity of the day. You can see how many encounters you have seen, how many encounters are incomplete. Incomplete meaning you have not signed their document, how many pending documents are there, what is the average encounter time, all of that. Here you can see I have added some dummy data for which the consultation summary has not been signed, so you can see that directly from here also. And then moving forward, we have the feedback module. So if you have any feedback from the patients or from your team, you can view it here. Then this is your recall board. So if you want to add a recall for a patient down the line after 3 months, 4 months, whatever, you can create a recall directly from here. Now this is the messages module. Here you can view messages from your team or from patients, and you can also see your reminders and recalls directly in this system directly. Now this is another customization, one of our very popular customizations, which is a task manager. So the base OpenEMR doesn't come with a task manager, so you can view your tasks which you have assigned to maybe your front desk team, billing team, anyone in your office, and then you can view the status of that task directly. And if anything is assigned to you, you can mark it as completed, or you can reassign it to someone, or you can archive the task directly from here. Now, this module is used to create a new patient, view the existing patient's dashboard, their visits, records, their prior authorization report, all of that. Now, this module is for group appointments. You can see the different group appointments created. You can create a group appointment. You can create a new group. All of these details you are able to see in this particular module. Now moving on, this is your billing module. Here you can add a payment. You can check out a patient. Then this is the billing manager module. So the base OpenEMR billing manager doesn't look like this. What we have done here, which I prefaced earlier also, is we have integrated this particular system with Availity. So what you can do is you can bill the patients directly from OpenEMR. You don't have to go to any third-party screen, and all of that is automated as well. So if you have an appointment where you have not entered a CPT code diagnosis, you have not signed the document, that comes as empty. Let's say you have entered those details, but you have not signed or logged the document, it comes as draft. When you mark the appointment for ready to be billed, this is how it looks. So if you have a QC team or a coding review team, this is where they will see that. Then if the claim is ready to bill for primary, this is where you'll see that. If the claim is ready to be billed for secondary, you'll see that here. Now, once the claim has been submitted to the clearinghouse or the insurance, it will mark as billed. And once it has been billed and the payment has been received, the ERA EOB has been posted, it comes as completed. And for any reason, if it is denied, it comes under denied. And any claim you want to rework on, you have this action button here. You can select the claim and you can click action, and you'll be able to resubmit the claim after making the necessary changes. Then under fees, we also have batch payments, posting payments, EDI history, all of that as well. Under batch payments, you can post EOBs, ERAs manually if you want to do that, but this system automatically does that as well. Now, this modules is basically to enable or disable any module within OpenEMR, and you will be able to do that as well. Now, this is an inpatient module. This is also a customization we have added for our inpatient clients. So if you have bed capability or capacity in your clinic, we can build this for you, and you can add a new bed. You can see the bed list. You can assign a patient bed. You can see the inpatient list, or you can release a patient from bed and all of that. Now, this is inventory. If you have syringes, or if you have any vases or anything like that, which you keep in the clinic, you can manage it directly from this inventory module. Now, this is your procedures module, which is your lab procedures. So here you will see all the lab integrations. For example, if you're working with LabCorp, Ammon, any of those labs, we can integrate it, and you can send lab orders directly to those particular labs. And you can also view the results which are coming in. So under patient results, you'll be able to, once you refresh it, it will automatically pull the data from those labs and it will post it here. You can also see the configuration, meaning which tests you want to order from the system. You can add or delete them at any time. You can see the compendium, the review, all of those details you'll be able to see it from here. Now, this is your admin settings. You can configure how your EMR looks. You can see the facilities, calendars, you can see the holidays. All of those details you'll be able to add it directly into these settings. Now, under reports, you have different kinds of reports. Obviously, we can customize any report for you as well. You can see the collection reports, you can see the CPT reports, configuration reports, all of that under here. Now, another level of customization that we do is on the encounter level. So let me open a encounter here. So on the encounter level, obviously for different specialties, you have different forms. So here, if you look at for a lot of our clients, what we have done is we have customized a lot of forms for different specialties. So you can see all of these specialties, and any specialty form that you think that is useful for your use case, we can essentially build it in the backend and you can use it in the system. So this is the customization. Now, the major thing I wanted to show you here, working after this base OpenEMR, is the customizations we have done. So this is a customized setting module which we have created for our clients. So basically any customization that we do, you feel like, okay, you don't want to use it, we give you an on and off button. in this module, and you can enable or disable it. So you can see for each particular category what are the customizations we have done. So for example, if you want to enable or disable a form, you can just come in here and you can enable or disable it. If you want to make some changes on the encounter customizations we have done, if you want to enable or disable third-party APIs. So here in this system, as you can see, we have a Ring Central integration for telemedicine, for telecalling, for SMS, all of that. We have a e-prescription integration with New Crop. We have a HIE integration, which is new in the market with One Up Health. We have a phone integration, Jitsi, Google Meet, Google Drive, all of these you can enable or disable it. Then we have the fee sheet integrations here, or a CRM integration. Anything that you can think of, or any customization that we do for you, we'll be able to enable or disable it from here. So this is in summary what OpenEMR is and what is the level of customization we can do. Now, obviously, you guys will have a lot of questions. What about AI and what we are doing on the AI level? So on the AI level, we have been working with a lot of our clients for these particular capabilities. So all of these capabilities are live for our clients. So we have built a AI patient summary. So for example, if you go to a dashboard and if you want to summarize any particular encounter or anything about the patient, you can do it directly from there. Then we have a clinical transcription. So you can record an audio when you're talking to the patient, and then it will automatically build the transcription. It will put it in the system. Then we have medical scribe. So once we have the transcription, it will automatically generate a structured note or any note that you can think of. Then we have a healthcare chatbot. So if you want to ask questions about the patients or any diagnosis you are confused with, you can do that directly from the system as well. Then for documentation, we have, if you have a documentation which you want to review, if there are any missing diagnoses, incomplete plans, you can do that directly from here as well. Also, we have a AI coding assistance. So if you have any ICD-10 questions or CPT questions, you'll be able to do it from here. Then we have AI billing assistant. It will validate your billing or coding which you have done, or any care gaps which you have, you'll be able to do that. Now, we also have automation customizations. So this is what I want to show you. Let me show you the AI module which I was talking to you about. So this is a AI dashboard. So you can see the current practice statistics here. Then if you want to generate a AI assessment after a while, after you have added a couple of providers and what it looks like, you can see that directly from here as well. Then you can see this AI dashboard. So here you can see which LLMs we are using for different areas. For example, patient summary will give you an option of multiple LLMs which you can use for ambient AI, medical scribe. All of these details we can build it into the system. Now, another thing which is very important nowadays is the automation. So on the automation side, what we can do is we can automate your notification and alert center. So for example, let's say you want to send the reminders to the patient 1 day prior to their appointment, 30 minutes prior to their appointment. We can configure that. Then we have prior authorization management. You can see the status cycles. You can assign authorization cases to coordinators. You can track that CPT code usage. Then obviously I showed you the task manager. Then we have billing KPI dashboard. You can see the practices collection. You can see the patient insurance payment breakdowns. You can see the financial. You can see the total AR for 30, 60, 90, 120 days. Then you have provider productivity, compliance, operational KPI analytics, and documentation reminders, all of that. So this is what the future looks like. And also we have been working on some of the other capabilities as well. But just to give you a gist, this is what we have currently with OpenEMR and what we can build. So if you guys have any questions, feel free to add them in the comment section, and I'll be reviewing them within a few minutes and hopefully answer your queries from there.